Hello, my name is Christina Sohatsky, and I lead our healthcare and life science practice group in Saudi Arabia. Today, we will be talking about all the activities we did this week around Arab health and some of the trends for the region. I am joined by my colleagues, Andrea and Abdul Mohsen. And Andrea, I'll let you introduce yourself.
I'm Andrea Tythcott. I'm a partner in the firm. I lead the healthcare and life sciences practice for the Middle East region. I'm based in the UAE. And we've had a wonderful week with the Arab Health Conference. And we're here to tell you all about the exciting things that will follow.
I'm Abdul Mohsen Al-Saleh, trainee lawyer at the Riyadh office. And I'm working within the healthcare and life sciences group sector.
This week, we've been quite busy. Normally, we have one small briefing. This week, we had two very large briefings. One was on UAE, one was Saudi, the two largest markets in the region. But we also heard from regulators attending the event from quite a number of different government authorities. So, Abdul Mohsen, you spent quite a bit of time actually getting to you managed to navigate to the event because it was quite busy. And so between the different sessions you attended, I just thought I'd hear from you kind of what you saw as some of the key trends happening from a legal and regulatory environment here.
Well, the event was actually magnificent. The amount of people that were able to attend, coming over from across the globe, which was quite impressive. The people were really excited about the opportunities that were here in the region, whether it's in UAE, Saudi, or even in the wider region. And I felt that the most significant topic that they were interested in was around digital health and the digital transformation in the health sector, which I believe is the future. However, from talking with the regulators, we should watch the space in terms of the developments that will gonna happen within the regulations specific to data management and information security, because as you may well know, people are really excited about adopting AI technologies within the healthcare sphere. And it brings with it a lot of complications, which hopefully the regulations will be able to solve. Quite
a bit of risk, right? So it's one thing to use it in our personal lives, just day to day, but another thing to use it in the healthcare context. Andrea, you had a fantastic panel with quite a number of the regulators from the UAE, and as we know, there's been quite a dynamic shift in the roles of the authorities here, even the creation of some new authorities. Can you tell us a few highlights from your session and those conversations?
Yes, well, we had a wonderful event earlier this week focusing on the UAE, followed by another event focusing on Saudi. This year, for the first time in 10 years, we've split our briefings over 2 days because we had so much to talk about. So in the UAE in particular, there are a number of key structural reforms, principally in the Emirate of Dubai. On the one hand, we have had a change in the law that now carves out the Dubai Health Authority as a sole independent regulator for setting law, policy and enforcement. Dubai Health Authority formerly operated and managed the public health system. That's now been transferred to a new corporation. The corporation is currently called the Dubai Academic Health Corporation, but there will be a rebranding exercise, and so it may reform itself with a new name very soon. We were very fortunate on our panel to have panelists both from the Dubai Health Authority and from the new corporation who talked to our audience of approximately 150 people in the community and internationally as to what the regulators were doing, what they were trying to achieve, and what that meant for the private sector and all of the other services providers that will support these initiatives. Because for the Emirate of Dubai, and as part of the vision of His Highness Sheikh Mohammed bin Rashid Al Maktoum, who mandated this change to be made, he didn't want to transfer the public health system from one place to another and have it run as it was in the past. The whole purpose of this is to reinvent that public health system implement a new governance model, have innovation at the heart of the strategy. The new public health system also absorbs into it a medical university, the Mohammed bin Rashid University of Medicine and Health Sciences, which has been established for some time now in Dubai. It's the home for training for medical students. It's also the home for R&D and clinical trials work. With the support of the government of Dubai, they will now be able to launch this on a completely new level. And what they're looking at is all of those services providers that can come in and support not only the delivery of clinical services, but training, education, accreditation, the establishment of centres of excellence, bringing in more research and development, doing more clinical trials work, developing new IP, creating personalised medicine therapies, and then through those new therapies and new services, driving those benefits back into the heart of the delivery of services for the benefit not only of the population, but all the medical tourists that are going to come to benefit from what is being done here. And they will create, it is already a very good level of medical service, but they will create one of the best medical services in the world.
And we see this renewed focus on workforce development, on homegrown clinical trials and research, on almost the exact same thing happening in Saudi in terms of separation of the regulator and the private. So tell us a little bit more then about that. The new health holding company, the Ministry of Health, what are their roles looking like?
Through mid last year, which essentially separated the regulator and the actual healthcare service provider in KSA, whereas there was a health holding company formatted to handle all of the healthcare services in KSA, along with the formation of 20 health clusters, as we call it, which are essentially it's spread out throughout 20 regions within the kingdom, and the plan is for each health cluster to develop its own and provide services within the region specified to them, while the MOH will be a standalone regulator for those health clusters.
Which hopefully then the idea is that will allow the regulator to be much more focused, right? Then the focus can shift to creating more, maybe it's a department or a new quality regulator, for example. As you talked about data, gathering and actually being able to analyze data for capacity planning and a variety of other services. And something that came up is so much we're talking about what's the government doing. And particularly in Saudi, where about 20% is private sector, there's still, that sector is not forgotten there. And I think the government is still seeing that there is a role for the private sector. It is growing. And when you talk to, for example, the Ministry of Investment in Saudi Arabia, they have identified where their gaps are and see that is going to be required some sort of collaboration with foreign investment. So I think this year we're going to anticipate quite a few key opportunities coming out from, for example, MISA or from the Ministry of Health that say, this is where our gaps are, this is what we need, these are the incentives we're willing to provide, come either whether it's a tender, public-private partnership, or simply just 100% privately run enterprise, but some sort of collaboration where the government is going to assist those private sector participants to get up and running in what has historically been a tough area for foreign investment. But as we know, those laws and regulations are indeed quickly changing.
Yeah, and this aligns itself quite perfectly with the Vision 2030 that we have in KSA. Yeah, hopefully that will be a key development.
Yes, indeed.
And we see some synergies in terms of the development of the private sector in Saudi. Just reflecting on what's happened in the UAE, where you have mandatory health insurance, where employers are required to have health insurance in place for their employees and to make contributions to that insurance. That's typically operated by the private sector, and that's resulted in an explosion of private sector operators here. Homegrown brands and international brands coming to support the employed workforce. And I guess we're going to see the same thing in Saudi Arabia. So lots of room for
Yeah, I
private
think
sector.
the trend is universal health coverage, right? It looks slightly different in of course, every country, but bringing everybody into that fold, which inevitably will drive up the services, the accessibility to care.
So we've seen a lot of AI at Arab Health. Can you tell us more about AI within the healthcare sphere in KSA?
Definitely. When you talk about technology, AI is now involved in every element of that. Even at the conversation we had with Sadaya in Saudi Arabia, they have a whole division focusing on AI in healthcare. Well, AI in general, but of course, healthcare is a part of that. What has been quite interesting to see is that, particularly, UAE has been on top of this for a while, but particularly in Saudi, the pace of change of the regulations has become so quick to adapt to quite a few of these new technologies and systems and innovative ideas. And for example, last year there was issued an SFDA guidance on AI and machine learning in medical devices. And how, as a regulator, do you approve those? How do you define that they are medical devices? How do you, what's needed to prove the clinical validation of them? How do you manage the risks? And also then, how do you ensure that the output is actually meaningful? It's not technology just for technology's sake. Coming back to what we see in the kingdom about the model of care, the patient being at the center, and how do the regulations then keep that in mind? And so we have written about this a bit further, so I won't go more in depth. But Andrea, I know in the UAE there's also been some new guidance as well. Maybe you can tell us a bit about that.
Yeah, absolutely. I mean, in terms of technology and AI, and the use of digital healthcare in all of its forms. The UAE is now a huge consumer of digital health. We have apps on our phone with access to some of our medical information. We can easily access medical consultations through telehealth. We know that the regulators are actively requesting the international community to come in and talk to them about what they're doing in the technology in the AI space, to understand what's out there so that they can acquire the best of the best. And so what we have in Abu Dhabi through the Department of Health is a relatively new standard on AI in the healthcare sector. It's a very high level principle setting document that says, yes, we want this, and we are going to regulate various aspects of it in more detail, but they haven't done that yet. And through that, there's a remarkable opportunity through, not only the opportunity to influence new regulations, but the opportunity to have conversations with a very open and receptive regulator. Similarly, in Dubai, the Dubai Health Authority for a long time now has had their smart data team who have been working on various digital health regulations, telehealth regulations, but also actively wanting to have new technology. Technology like having drones that will fly into the desert, carrying medical equipment and tests to remote areas so patients can access that more easily. All kinds of innovative solutions in the digital space. Now, inevitably, technology is always going to be ahead of regulation. And so all technology providers and innovators, of course, understand that anyway. And there are always some challenges with that, but with those challenges come huge opportunities. And we want the technology here. The regulators are very interested and receptive to it. And they want to have the best system in the world. And that means they need to have the best technology in the world to support it.
We're asked always over and over again, where are the opportunities at the strategy level? We know each of the countries in the region have their own set strategies, whether it be, for example, across the region, but I know, in Saudi, the shift towards primary care, and what does that look like? And from a legal, regulatory, but also in practice point of view, can you highlight a few of the key areas of focus here in the UAE in terms of the different divisions of healthcare?
Well, I mean, you've hit the nail on the head there when you mentioned primary care services, because whilst that may be completely normal in other jurisdictions, it's still quite new here. We have not had a system of primary care, secondary care, tertiary care, where there are very clear lines of delineation. It has been recognised for some years that we need a primary care service. We need that primary care gateway. And each of the regulators in Dubai and Abu Dhabi have put in place strategies for this. It's one thing to put in place the strategy, it's another thing to be able to implement it. There is a worldwide shortage of general practitioners, family medicine practitioners. Having sufficient primary care practitioners in country has been challenging. That is improving through various incentives that are offered to those specialist physicians, golden visas, 10-year visas, lifetime visas, in some instances, UAE passports, looking at retaining that talent for the long term. I spoke in that respect with regard to primary care services, but of course it's much broader than that, because we want all those other specialist services, cardiology, cancer, mental health. We want all of these experts here for the long term and to bring their families with them and to have a very comfortable life. So primary care, cancer, mental health, they're just three of a number of priorities. Each of Dubai and Abu Dhabi have master capacity plans where a significant amount of data has been analysed. Back to data again. Significant amount of data has been analysed to understand what's the service provision in country. Does that match our population size, our population health needs now and in the future? Where are we oversupplied? Where are we undersupplied? Where do we need to fill those gaps? And how should we fill those gaps? And this is not a straightforward patient bed infrastructure type calculation, because we also have to inject into that model the fact that we are moving to digital health solutions and we are moving to wellness prevention and keeping people well rather than treating them when they're sick. And so the priority matrix has to match that ambition.
Speaking of virtual care, Saudi has a 100% virtual hospital, Seha, run by the government. So we're already there. Well, fantastic. With that, I think we will close. I'm sure we can continue to talk all day. But as I mentioned, we are from our Healthcare and Life Sciences Practice Group. We do operate across our 17 offices in 10 jurisdictions, supporting both providers, the pharmaceuticals, medical devices, pretty much everybody in this space. And we'd be pleased to support you should you have any further questions. Thank you.